and it seems to work extremely well. Now, that's a prototype, and I don't know how many other schools are going to be interested in that or will eventually develop that kind of a program. But that's what I'm talking about when I refer to prevention.
One supplementary. The most difficult problems that we have to deal with are usually with students who are very disaffected with therapy of all sorts, and very often they come to us in that, with that kind of attitude. What do you do with those students?
Well, if we're referring to the disruptive student, then they have to, you make the offer. And if you have mental health services available in California, that would be a bit of a luxury among the community colleges. But if you have it, then you offer it. If the student is disillusioned with therapy and what it has to offer, and why not? Many of these students, unfortunately, have not gotten better, or whatever better is, as a result of therapy, then they are cynical about it and say that, I've already had lots of therapy and I don't need that anymore. And besides, they're going to only put me in a mental hospital if I go see them. And there are a lot of suspicions and worries about all of that. Then the approach, I think, is to tell the student, look, I'm suggesting this. I think it's a sound recommendation, and I hope that you would pursue it. But it's your prerogative to not go to a therapist. It is not your prerogative to continue behaving disruptively. That's the crux of it, you see. That's the crux of it. Thank you.
Dr. Amada, in your discussion on dangerousness versus disruption,
Yes.
you seem to intimate that the instructor's assessment or the staff member's assessment of the dangerousness of the student is sometimes inaccurate.
That's right.
In light of our recent experience in Montreal, I think an administrator would be very reluctant to underestimate the dangerousness
Good.
of a student.
That's good to do.
Why you said that?
Well, I said it because my experience in most colleges that I've consulted with and in my own college is that these problems do get minimized too often. And it's because perhaps that the instructor has not sufficiently documented, you see. So that by the time, when the report is transmitted to the administrator looks at it and says, well, I don't have a report on this student. You haven't said anything, you haven't done anything, you haven't written anything. And the instructor says, yeah, but it's really flagrant, it's completely out of hand. And so, well, why didn't you complain earlier? So that's how it gets minimized. And I think that is unfortunate. So and as I said just a moment ago, too, I think many instructors don't recognize an abusive situation when they see one, or they become paralyzed by some of these situations. They know there's something bad going on, but they don't quite know how to handle it. So they just sort of think, well, it's not as bad as it really seems to be, until there's really attrition in the class. I've seen this happen where 3/4 of the class drops out, and then the gravity of it all surfaces. But that's been my experience, and of course here I would understand the reasons for what you said. Here in Montreal, I would doubt that would happen. Yeah.
Dr. Amada, I'd like to go back to your position on the required referrals. The examples that you've been giving for disruptive behavior have been, for the most part, involved in the classroom. I'm at a residential college, and our examples of disruptive behavior are most typically in the residence halls.
Yes.
From what you appear to say, it seemed to be that the option that would be given to the student was either a withdrawal without any penalty, a voluntary withdrawal on the part of the disruptive student, or a disciplinary action. Is there not a middle ground where referral for therapy would be, first of all, offered, and then if not taken, given as an option that the student would either be required to leave the residence hall or leave the university or be involved in therapy?
Mm-hmm.
Now, coupled with that, just in terms of the confidentiality aspect, I think that you can require that and still maintain the student's confidentiality in terms of what is going on in the session.
Yeah. It gets pretty ambiguous, though, doesn't it? It gets fuzzy because the student does know that he's going to therapy, and that's a very important piece of information. Now, I don't want to sound really rigid about this, but I think there are more disadvantages to that situation than there are advantages. I think, again, whether it's a suicidal student or an anorectic student or a chronically drunken student, whatever the case may be, I think that the student should be approached in the following manner, and that is the student should be told, look, this is troublesome. It's troublesome to you. It's troublesome to other people. And what you probably could do is, we have a mental health service on our campus, and I think you should go to that. It would probably be helpful to you. I don't think you should say to the student, and this is actually what is being said to students everywhere. I do object to it. They're being told that you must go as a condition of continuing in the school. I don't agree with that. Now, why I don't agree with it is partly the confidentiality issue, partly because I don't think students get the point in those situations. I think you're not really driving home the point when you send somebody to a therapist. What you're suggesting, I think, is that the real issue then is their emotional problem, their mental illness, whatever that may be. The real issue is how they're behaving. And I think in some ways you divert them away from that by sending them to a therapist who will probably try to talk with them maybe dynamically about what's causing it, maybe partly about their behavior. But in the long run, I think it really diverts the issue from where it belongs, which is to say to, and this is what I would suggest saying, is look, whether you go to therapy or not, this behavior must stop right now. And see, the other pitfall is this. Well, there's a couple of pitfalls. One is that this student you're referring to therapy may have already had 14,000 hours of therapy already. That's one. The other, as I've already mentioned, is you get the person into therapy and they continue to be disruptive, but they fulfilled your requirement. That's.
I would certainly see that the behavior would have to be coupled with that. This would be the option, and I don't think that you'd get to that point as an initial response. I would agree with you that behavior of that nature would probably be somewhat ongoing and would have initially responded with advice to dealing with it. But I guess I'm coming to the point, when you get to the point of the suicidal student or the anorectic student or a student who's abusing alcohol, when you're at the point that they can no longer continue in the residence hall, for example, do you give that person one last chance, in effect, to say, okay, the choice is yours, you either leave at this point, or you now do take care, or begin to address the problem, and of course, coupled with the expectation that the behavior will change.
Yeah, well, that's an interesting question. I was going to mention it here in the paper, and that is that let's say you're dealing with a suicidal student, somebody who is repeatedly suicidal. Well, I think we should make an assumption that this person isn't only endangering their own lives. This person is a menace to other people, if I'm not mistaken. Usually on an interpersonal level, they are really disturbing the people around them. And I speak from an experience that I know about in my own family, where my daughter went to a college in San Francisco, and her roommate made an attempt, and it was devastating to everybody but the person who made the attempt. And it went on for weeks that way. I think that we have to look at this problem in a broader context, and that is that if this person is either drinking too much or not eating, is starving, yes, give them everything we've got: inpatient treatment, outpatient treatment, the whole range of services that are available. But in the final analysis, if they continue to behave this way, then I think we have to tell them somehow or other that you're not just you're not operating in a vacuum here. You are affecting other people. You are really disturbing a great many people around you, and you have to face the fact that you have to stop this behavior or you're going to have to leave.
Dr. Amada, my question is this generational problem. I'm a 24-year-old student, and I'm part of the last generation in the baby boomer backlash, and I'm under considerable anxiety. And I was asking myself, what would be the right time for the right people to interfere or to take action to solve the situation of the 20-year-olds right now? Can you hear me properly?
I can hear you, yeah. Okay.
Because there seems to be certain despair in our generation that the baby boomers did not feel, and I was wondering if that could be more reason for us to be disruptive as students.
course. If you want to look to the dynamics of this situation, yes, I think disruptiveness is a crying out, a plea for help, and an expression of despair. It definitely is, despair and desperation. And I don't know all the reasons for that. We try to cover a few here. I think that, you know, society is in trouble. There are certain signs, political and other kinds of indications of change and a new direction politically. But I think that within each of our societies, Canada's and the United States, there's a great deal of hopelessness. This, of course, is especially the case among those people who are referred to as the underclass. You know, people who live in poverty. And at least in my memory, you know, I can remember the Peace Corps and the Kennedy years when there seemed to be, you know, a good deal of idealism, people looking forward to doing things and serving. There seems to be a little less of that these days, although I hear people say that this new generation is activist in some sense, and they do demonstrate, they do have a purpose, and I don't know whether it's a Porsche or something else, but I wish I could say more about that or explain it better. But, okay, we have 3 more questions, and that should do it.
To continue on this issue of contributing factors, you talked about the laissez-faire attitude of faculty members and staff. I wonder if another contributing factor is that the universities themselves are not setting the models of what appropriate limited behavior is. I mean, we all know that we have our share of faculty members and staff members who are themselves disturbed, who are often engaging in abusive behavior with their students, colleagues, support staff members. The institutions very often take on a long time to deal with those. So you have that as a poor example being set. But also I think in the way that universities conduct themselves in debates, Senate, whatever the governing bodies are, there's not the level of civility that is going to send proper guidelines, I think, to people who are disturbed, people who may not yet be disturbed. So I'm wondering if one of the things that universities, colleges should be doing is to just stop having codes of student behavior that differ from the behavior that they demand of everyone else in the institution. I know that often brings
Good point.
that often brings you into conflict with humans.
Yeah.
We somehow are asking one thing of our students and not giving
Yes.
ourselves at least an argument.
Yeah.
Like the comments.
Yes, you made a very excellent point, and I'm sure my school is no exception. We have a great many difficulties with faculty who are sometimes sexually harassing students, other times are just poor teachers, who are sometimes merciless towards students who don't understand something, get very punitive. There are a great many horror tales that I hear every day from students about how in what demeaning ways they're spoken to. There are mentally ill faculty, and some of the mentally ill faculty are very good teachers, as a matter of fact, so I wouldn't say it's those who are mentally ill are necessarily going to be poor teachers or destructive. But you made an excellent point, and it's interesting. What I'll have to take back to California is: do we need a code of college conduct or code of faculty conduct, staff conduct, to parallel that we've imposed upon students? It's an excellent point.
I'm wondering if you've noticed any tendencies in the sex of the disruptive student and in the sex of the faculty member in situations of disruptive classroom. At my university, there seems to be a problem emerging with more women faculty being hired, having to teach in larger classrooms. There seems to be a tendency in those classrooms for students to be disruptive, to be harassing of their female professors.
I can't be very precise about that. I haven't ever kept any statistics. I see a great many male faculty reporting male and female students, a great many female faculty doing the same thing, male and female students. The male students tend to be, I think, somewhat more menacing in the way in which they threaten and disrupt than the female students. But I could understand, I think I could anticipate that if there is an increase in the hiring of women, that many students, especially male students, would begin to take that as a signal or as a license for challenging authority, considering how many men view women. It's unfortunate, but that's probably the case.
I think it probably ties into the point made
One
by
more.
the last speaker that, again, it's permission of what happens, the signals that are sent out by faculty and staff about how to treat different individuals at the university.
Yes. Thank you for your question. This will be our last question.
And this is more of a comment, I think, than it is a question. And it may be that my experience is unique, and therefore what I'm about to say can be duly disregarded. It seems to me that the kind of disruptive behavior that you described, I think, are relatively easy to deal with. That is, you have a student in a classroom who's being disruptive, or a student in a dormitory that's being disruptive. Those cases, I find, are not all that difficult to deal with. Where I think the change has occurred, particularly in the last 10 years, is when you have, for example, a public incident in which a black male is accused of sexually harassing a white woman. And what happens is that disruptive behavior then becomes an issue that divides groups on campuses. Or you have an Asian student who is accused of racism by a black male. And I think it is in those areas of disruptive behavior that it becomes extremely difficult to adjudicate in any kind of a manner in
Yes.
which groups view as having due process or which groups view as being just. And that in turn has another spin-off that carries you to a year that can be an absolute horrifying event. And that's what it seems to me is the major difference in the kinds of issues that college administrators find themselves dealing with now.
Yeah, I'll just finish by saying that's a very good point. I haven't included it, but I come from probably the most ethnically diverse college in the country, in the United States, and maybe in the world. We have a large number of Asian students, black students, Hispanic students. The white students are in the minority at my school. And it is interesting sometimes when these disruptive incidents occur to keep an eye on the process by which they're resolved. And sometimes, let's say it's a black student who's been the disruptive one. Well, a great many of our administrators who are handling these disruptive situations are sometimes, because of their empathy or identification with the black student, are saying, well, it's not really disruptiveness, that's the way the brothers sometimes act, you know. And they have a point, you know, and so it gets very complicated because some of the other faculty, say the white faculty, are saying, well, that's not my standard, that's not my norm, so I don't accept that. And it does get complicated. We have a large gay population. Some of that issue may impinge on this as well, where there's homophobia, and homosexual students are sometimes harassed for being gay. And you know, there's just so many interest groups and so many ethnic groups involved in this, both within who are working for the college as well as the students themselves. That it actually, you know, it really does. I was going to say color the situation, but I guess that's the term for it. It really does in a great many subtle ways. Thank you very much for letting me come out.
Thanks a lot, Jerry. You certainly provided a really good overview of your experience as the first expert in the area of disruptive behavior. And things did go better after your jokes at the beginning. I think that there were several issues that were raised that are worth just quickly reviewing. I think the issue of date rape is an important one that needs to be paid attention to. The concept of humanity of actions, which both Dr. Kniff and Dr. Amada responded to. And the fact that we're dealing with the consequences of behavior, not the illness itself. One of the things that I was going to mention, but it really was already mentioned, that at Concordia we've tried to deal with, we started off with dealing with disruptive behavior from students and realized very quickly that although some of the procedures would be different, the issues, and some of the issues may present differently, there really was a problem from all parts, the disruptive faculty, the disruptive staff, and the disruptive student. And our Concordia Code of Conduct, I think, is unique in Canada in that it does address the three areas. And we have dealt quite substantially with the faculty and staff disruption as well. So thank you very much, Dr. Amada, for sharing your experience in California, and certainly for pioneering in the area. I think it was very reassuring for us to read the article that you wrote in 1986, that we really weren't the only ones here who are experiencing the problem, although people will still say, we don't have disruptive behavior at our campus. Suzanne has asked me to just make one more housekeeping announcement. For those who want the vegetarian meals, there has to be a special mark put on your ticket, so if you could go to the desk during the break, we'd appreciate it. It's 10:32. If we can grab coffee and come back for quarter to 11, we can stay on time. Thank you.
Tangible.